vaccines and booster shots. Dr. Walensky.
Thank you, Jeff. Good morning. Let's begin with an overview of the data. Today, our 7-day average of cases is about 106,400 cases per day, and the 7-day average of hospital admissions is about 8,300 per day. Both of these are about a 15% decrease from last week. 7-day average daily deaths are at 1,476 per day. You've heard me say it before. Vaccines are the most powerful tool we have to prevent COVID-19 infections, hospitalizations, and death. The power of vaccination is not just for the individual who gets the shot, it is also for those around them and their community. Today, I want to share with you new data that demonstrate just how essential vaccination is in our fight against COVID-19. About 185 million Americans have rolled up their sleeves and are fully vaccinated against COVID-19. Unfortunately, that leaves about 70 million eligible Americans unvaccinated, and these people are not evenly distributed. There are still places around the country where far too many individuals remain unvaccinated, and many states where vaccination rates are less than 50%, leaving themselves and their communities at risk and without adequate protection against COVID-19. We're beginning to see cases and hospitalizations decrease from their peaks in late August and early September. This slide looks at the 7-day moving average of cases, hospitalizations, and deaths in 3 groups of states. In blue, those states with less than 55% of their eligible population fully vaccinated. In yellow, those states with between 55 and 65% of their population fully vaccinated. And in green, those states with greater than 65% of their population that's eligible fully vaccinated. In the panel on the left, you can see weekly COVID-19 case rates. In those states with less than 55% of their eligible population vaccinated, case rates were consistently higher than in states with higher vaccine coverage. At the peak of the summer Delta surge, the low vaccine coverage states had a case rate that was over twice the rate seen in medium and high vaccination coverage states. In the middle panel, you can see the same trends are seen for weekly hospital admission rates for COVID-19, with low vaccine coverage states having higher hospitalization rates and remaining substantially elevated even as case total rates begin to decline. And in the panel on the right, deaths remain substantially higher in states with low vaccine coverage. These data make 2 points abundantly clear. First, COVID-19 vaccines are highly effective in preventing severe disease, hospitalization, and deaths due to COVID-19. Second, high vaccination coverage in your community translates into fewer cases, less of a burden on your local healthcare system, lower disease rates in your classrooms, and better health for those around you, including protecting children less than 12 years old who are not yet eligible for vaccination. While we have made tremendous progress in our campaign to vaccinate as many Americans as possible, we still have work to do to make sure that vaccination coverage is high and even across the country. This week, CDC released a health alert highlighting the incredibly low rates of vaccination in pregnant people and those who may become pregnant, a group of people who are at high risk for severe complications from COVID-19. Overall, only 31% of pregnant people are fully vaccinated, and only 15% of Black pregnant people are vaccinated. I want to reinforce that these vaccines are safe and effective, including during pregnancy. The benefits of vaccination far outweigh any risk to both mom and to baby. If you have not yet been vaccinated, I urge you to talk with your healthcare provider and those in your community about the benefits of vaccination. Vaccination is our best defense against COVID-19. We have the scientific tools needed to put an end to this pandemic. We have the science that proves these vaccines are safe and remain effective, and I am confident that we can come together and protect ourselves and our communities from COVID-19. Thank you. I'll now turn it over to Dr. Fauci.
Thank you very much, Dr. Walensky. I would like to now provide 3 concise messages about how we can accelerate the end of the epidemic in our country and the pandemic globally with vaccinations. First, COVID-19 vaccines are safe, effective, convenient, and free. They protect you, your loved ones, and your community. Next slide. This is just one bit of data among many from a variety of local locations throughout the country. In this case, it's from Public Health Seattle and King County. This is COVID-19 data over the past 30 days, essentially Delta data. People who are not fully vaccinated are 8 times more likely to test positive, 41 times more likely to be hospitalized, and 57 times more likely to die compared to people who are vaccinated. Next slide. Next message. Booster shots provide further protection against SARS-CoV-2 infection and symptomatic COVID-19 disease for people at increased risk of severe COVID-19 disease. Next slide. This is the slide I showed at a prior press briefing. 12 days or more after the booster dose, the rate of confirmed infection was lower in the booster group than in the non-booster group by a factor of 11.3, and the rate of severe illness lower by a factor of 19.5. Next slide. This is active severe COVID-19 cases by vaccination status in individuals over 60 years old in the Israeli study. And the numbers you see are numbers per 100,000 population as of a couple of days ago. 174.2 in the unvaccinated, 33.7 in those who have 2 doses of an mRNA, and 3.4 in those who had 2 doses of the mRNA, in this case Pfizer, plus a booster. Next slide. Third point, vaccines for children aged 5 to 11, pending FDA authorization and CDC recommendation, may soon be available to help protect our children and those around them. Next slide. As you know, a few days ago, Pfizer and BioNTech submitted their data to the FDA from their phase 2-3 trials of their vaccine in children 5 to 11. The N was over 2,000. The companies report that the vaccine demonstrated a favorable safety profile and elicited robust neutralizing antibody using a 2-dose regimen of 10 microgram doses. Again, the FDA will make a regulatory determination, and the CDC with their ACIP will make a recommendation. Last slide. So therefore, the conclusion from the 3 concise messages are, as Dr. Walensky said so cogently, get vaccinated. Hear how you can find it, vaccines.gov, text your zip code, call the telephone number on the slide. Back to you, Jeff.
Thank you, doctors. As both Dr.